Nurses at two of Maine's largest hospitals say their patients are not getting quality care. And those nurses say that their working conditions are to blame. Pearl Small is live outside Maine Medical Center in Portland tonight to explain. Pearl?
Hey Chris, the nurses I spoke to say they're used to taking, depending on the level of care, between 2 to a maximum of 4 patients per shift. Now a lot of them say they're being forced to take up to 5, and that is really impacting their work in a lot of different ways. They say that they're forced to miss steps because they always feel like they're running out of time. Sometimes they're making mistakes, and it's just overall negatively impacting the health and safety of their patients. Now, these nurses really feel like the solution is in the staffing, but the hospital leaders don't quite agree with that.
The reality is, nurses are rushing from one room to the next, frantically juggling care for too many patients.
Nurses from 2 different hospitals, Maine Medical Center in Portland and Eastern Maine Medical Center in Bangor, are continuing the fight for a nurse-to-patient ratio they feel comfortable with.
As nurses, we know our patients can and should have the best care possible, and we will not be deterred.
After a bill that would mandate nurse-to-patient ratios was rejected a year ago by the state legislature, the Maine State Nurses Association is putting it back on the table, hoping for a different response from hospital leaders.
There are no days that are exactly the same. Every patient's different. Every shift is different.
Faye Weir, Senior Director of Patient Care Services at Maine Medical Center, says their view has not changed. As a former nurse herself, Weir says patients rarely all require the same level of need, and staffing numbers should be determined by hospital management, not the law.
And so it's that collaboration that helps everybody as the team to get through the day.
Weir worries dipping the other way could be counterproductive, forcing hospitals to turn down patients if they're short-staffed or put them under deeper financial strain.
Ask the hospitals what their cost is of always having to recruit more and retrain nurses.
Kelly Brennan, a nurse at Maine Med, believes hospitals could actually solve both those financial and staffing concerns if they followed the ratio suggestions.
If it's hard for me to handle 5 patients, and I've been doing this as long as I can, our new grads are coming in and they're taking on more and they're leaving.
After 16 years of being a nurse, Brennan says the career is still what she loves, but right now, the job is what she hates. California is the only state that has ever actually mandated this kind of a patient-to-staff ratio, which I thought was interesting because both sides kind of brought that up to make their case. The nurses said that since that law was passed, nurse retention has gone up and they've been able to keep their nurses for a lot longer. But on the other hand, the director that I spoke to at Maine Med said that there's been no evidence to show that this has actually helped the nursing shortage in the state, and California is still in need of tens of thousands of nurses. So there's definitely some pros and cons to weigh on both sides here. Chris?
Certainly, Pearl, an ongoing debate live outside of Maine Medical Center in Portland tonight. One last note, while we were interviewing someone from Maine Medical Center, we also heard back from someone from Northern Light Health, which manages Eastern Maine Medical Center. They sent us a statement saying they always use the National Database of Nursing Sensitive Indicators to ensure that staffing levels are in line with other high-performing nursing organizations.